fertility specialist. Today I'm going to be explaining to you what exactly we see in semen analysis. Most of the couples that come to us for a fertility checkup usually think that in the male partner only the sperm count matters. But this is not the case. There are several parameters that we actually check when we do a semen analysis. To start with, firstly, the sperm count. Now the sperm count, according to WHO guidelines, a normal sperm count is 16 million per ml and above is considered as a normal sperm count. Second is the sperm motility. What is the sperm motility? So there is something called progressive motility. This is the ability of the sperm to swim, forwards towards the egg so that it can reach the egg and fertilize it. Now the progressive motility, again according to WHO guidelines, it is supposed to be 30% and above is considered as a normal motility. The third parameter that we see is the sperm morphology. Now what is the morphology is how the sperm looks. A sperm has a head, neck and a tail. So what we match is the exact how a normal sperm is supposed to look. We match the sperms to that and we see how the morphology is. So any deviation from normal, like an elongated head or some neck defects or a double tail, split tail, these are just to name a few. So any deviation from normal is considered as an abnormal sperm. So the sperm morphology cutoff according to guidelines is 4% and above. So if your morphology is 4% and above, it is considered as normal. So these are the main three. Now apart from this, there are other parameters that we see. For instance, now the volume of the ejaculate, the liquefaction time, the presence or absence of fructose in the semen, and the pus cells to rule out infections. So all this put together gives us an idea about the sperm quality and how the semen sample is for that particular person. So I hope you've understood that it's not just the count that matters. Now there's one more test called DFI, that is your DNA fragmentation index. So the sperm DFI is not done in all patients. We usually do it in males, couples who have long-standing infertility. They are infertile from many years, or if they have failed more than 2 cycles of IVF, or men with history of diabetes since many years, or men who are smokers. Now in these kind of couples, men, what happens is that the DNA fragmentation increases. So the DNA fragmentation index gives us an indication of the amount of DNA damage in the sperm. So obviously now once you understand this, you know that if the DFI is less, it is a better quality sperm. And if the DFI is more, it means that there is more DNA damage, and it means that it's not as good quality as a normal, as a low DFI sample. So this is again a test that we do in a few couples. So I hope this has cleared your query about what exactly we see in the semen analysis. Thank you.